Hello and welcome to our COVID-19 update, where we'll be speaking to the Minister of Health, the Honorable Dr. Frank Anthony. Hello, Minister. Thank you for meeting with us again today. So let's just jump right into it. It's been a week since schools have been reopened and the ministry has been doing tests on dorm students. And you provided an update for us yesterday where you said about 38 students, teachers, and staff who would have tested positive for the virus. Do we have any further updates on this?
Well, as of today, we have 30 students who have tested positive. We have 11 teachers who came back to teach, and they have tested positive. And we have 13 other staff. You know, in the dorms, you have the persons who are cooking and so forth. So we had 13 other staff who've tested positive. So all of these persons are now in isolation, and we'll see how that evolves. There's still some more testing to be done as students come in. We're expecting some of the students from the far-off areas to come to those dorms, and when they come, they'll be tested. So these numbers might go up.
Okay, so we're expecting to see testing going into next week?
Yes, more than likely, because I think the education system is expecting that they would have, over the weekend, they'll have students coming in.
Okay, if you could, you mentioned that these students are in isolation. Can you give us a little insight on where these students are staying?
We have, in every region, we have institutional isolation, so we can utilize those facilities, and in some cases that is what we have done. So for Region 4, for example, those students who were at President's College and tested positive, and the staff there, we have isolated them at our isolation facility at Diamond. In other cases, apart from the institutional facilities that we have, within the same building, you can isolate people because they, keep them in separate rooms and things like that, and make sure that they abide by certain protocols. So we're able to do that in some instances where you don't have an institutional isolation facility nearby, because when we look at the dorms, they're all spread out in different parts of the hinterland, and therefore that can be challenging to find an alternative area for isolation.
At this moment, can you say which region would have recorded the most positive cases of students, teachers, and staff that would have returned?
Well, we have dorms in Region 1, 2, Region 4, 5, 7, 8, 9, and 10. So in all these regions we have cases.
Thank you for that, Minister. Now let's turn our attention to COVID-19 and the new strain. Yesterday we would have spoken about Guyana not having the capacity to do genetic sequencing, actually. Can you, for the man on the street, can you explain what does this mean?
It's a special type of test. In every cell there's a nucleus, and in that nucleus you have DNA material. DNA is made up of what is called a nucleotide, and these nucleotides would have, they have 4 in DNA, and therefore it's, so let's say with these 4 they have letters to them, and depends on how you put those letters. So different types of protein, the instructions are given by these letters. So you can have a sequence maybe of A, T, whatever. So that sequence of these letters, how they are arranged, that is the sequence that you want to know. So in the case of a virus, you have some viruses, they're not DNA, but they're made of RNA in the case of the coronavirus. So the sequence of nucleotides, how they're arranged, you'll want to know that arrangement. And once you figure out that arrangement, each part of this RNA would account for some part of this virus. So for example, we have seen a lot of images of the virus where they have these little protrusions, or what is called a spike. So a part of this RNA would answer for the making of that spike protein, right? So when you do the sequencing, you're actually seeing whether or not each letter is in place, and if it's in place, then if it's in the right order and stuff like that. So that's what is called sequencing, because you want to see how these letters are arranged. Now, what has happened over time is that, like with most viruses, they have to reproduce themselves. And when they reproduce themselves, errors occur. And sometimes those errors are not fatal. In other cases, those errors can create new strains, as we have seen what is happening now. And one of the most recent strain is the B117 strain that has been talked about quite a lot, because the mutations where they occur, these mutations can have an impact on transmissibility, meaning that it can, more people can be quickly infected with this new variant. And that's why I think a lot of people are concerned. There's another variant that was detected in South Africa, and with that variant, the mutations are pointing to, and it has been postulated that maybe these strains of virus can cause a more severe form of the disease, meaning that more people can get sick. So these things would happen, mutations would happen, and the only way we can detect mutations is that we have to take that virus and be able to go through and do the sequencing to see what are the nucleotides that it's made up of and how these nucleotides are arranged. So that's basically what genetic sequencing is all about. We don't have that capacity here as yet. And because we don't have that capacity, we have to send samples. If we want to do that type of work, we have to send samples to other laboratories. In our case, we have worked out an arrangement with CARFA so that CARFA can do the sequencing for us.
Okay, I'm happy you mentioned CARFA, Minister, because that brings me to my other question. I know you said that we have that arrangement with CARFA, but have we had any discussions with them to send any samples?
Oh yes, we do.
Have we sent any samples?
We haven't sent any samples as yet, but we do have an arrangement where if we need to send samples, that we will be able to do that. The CARFA currently has a project where for all the member states that work with CARFA, they have put together this project where they'll be able to do genetic sequencing of viral strains. And each country would send samples to them. They would do the analysis and then send those results back to the country so that we can analyze what strains are circulating.
The country has the government would have had the arrangement with CARFA, but does this extend to private laboratories for the country as well?
Private laboratories would generally have to make their own arrangements if they want to do sequencing. But we, as the public health authority in the country, we want to know what are the types of variants that are circulating, and therefore, in some cases, we would then decide on samples that we want to send and to check these samples and so forth. So, I mean, that's a determination that is done by the ministry with our arrangement with CARFA, because if we believe that there's something that we'll want to investigate further, then that's what we'll do.
Okay, Minister. Now, I know it's about 6 months since you would have come into office and you've been handling the pandemic. How important it is for samples to be collected and stored properly for later analysis?
Well, it's important because we all know that there have been cases, for example, of reinfections. And if we store these samples properly and somebody gets reinfected 4 months from now, 3 months from now, we can always go back and do genetic analysis on the first sample, the second sample to see whether there are variants or what is happening with the type of strain that person was infected with. So there's a number of use why we should keep samples, and we have been keeping the samples so that we can go back and do some of these tests and analyses.
Okay, with the test and analysis, the statistics, what role does this play in decision making?
The statistics, it's very important that we know what is happening. So we are able every 24 hours to collate stats pertaining to how many people have been infected across the country, how many people have been tested, how many people have been placed in quarantine, how many people have been placed in isolation, whether it's home or institutional, how many people came to the hospital, how many people have been hospitalized, where they have been hospitalized, how many people are in the ICU, and things like that. So every day we use this type of stats that we're generating to be able to make decisions on one, where we see the trends of the epidemic and where this is going, and secondly, to be able to respond more appropriately. So we might be able to detect a spike in a particular region, and therefore we can activate teams to go and take a more proactive approach in that region. We would be able, because of the kinds of surveillance systems that we have, we will be able to detect if we're seeing more patients coming to the hospital, if we have a higher rate of hospitalization. So we are able to detect these things and start priming our system to make sure that we are able to deal with some of these cases. So it's important to have these stats. Without the stats, then it would be purely guesswork, and we don't want to have that. So since we came on board, that is the PVV civic government, we have started a morning meeting, and we do this every morning so that the technical staff from the regions, from centrally, can interact and put together all these information so that it's available every day. And persons who are required to make decisions from them are able to make those decisions.
Okay, with that, Minister, the number of active cases in the country is relatively low. I know our number of confirmed cases about 6,000 plus. Can you say if the number of relatively low cases is a result of the measures that have been put in place over the last 5 months or so?
I'm a little bit cautious when we talk about these numbers, because this thing is not a static thing. And while we have seen numbers come down, that does not mean that the epidemic is over, because when people start seeing a drop in the numbers, people get very complacent. We are by no means out of this pandemic, and because we still have people who are active cases, we would still have spread. And how much that would spread, how many more people would be infected, that's something that we can't predict at this point in time. And therefore, we have to remain cautious. So while we are working to bring down numbers, we also have to get people to ensure that they're doing the right things. Numbers coming down does not mean that we have to relax our approach to this pandemic. And very often I kind of see that type of irresponsible behavior because people feel that we're doing well and therefore we don't have to worry. We are expecting that we'll see some numbers going up, especially during this month, because some people did not adhere to the guidelines during the holiday season, and therefore we are expecting that we'll see a spike in infections and also hospitalization. We had lower numbers in terms of the hospital, but we are looking out for these spikes.
Okay, thank you so much for that, Minister, and thank you for your time today. This has been DPI's COVID-19 update. For more information, visit our website dpi.gov.gy or our social media platforms.